Hi, my name is Todd Rubin, and I'm a hand and upper extremity surgeon here at the Hughston Clinic Orthopaedics in Nashville, Tennessee.
So I'm Chris Jones. I'm an orthopedic surgeon here with Hughston Clinic, specializing in sports medicine and arthroscopic surgery.
This is a unique experience, mainly because I've had the privilege of operating on one of my partners, which not many orthopedic surgeons can say.
I go on an all-guys ski trip. I take a spill and obvious wrist deformity. Knew right away I had a problem. And the two guys are on the trip with me. They're like, what are you gonna do? Who are you gonna call? And I was like, no, I'm calling Rubin. And so I call him on the phone. I'm on a gondola going down the mountain. And I'm like, Todd, I broke my wrist. He's like, are you sure? Like, do you have an x-ray? I was like, don't need one, Todd. It's real bad.
To interject, there were a couple portions of the story left out. The first is that Chris calls me at the slopes and he goes, hey, what's up? What are you doing? And I'm like, I'm just seeing patients. It's Friday. He's like, okay, well, what are you doing this weekend? And I was like, I don't know. And we've known each other for 7 years. I think maybe he wants to invite me over, or we're gonna go out. He's like, all right, well, I broke my wrist. And I was like, I'm sorry. I think on the phone, I heard something, but we frequently share patients. And I think I heard that you broke your wrist. And he was like, yeah, pretty sure I broke my wrist.
How are we doing, Chris?
We're doing great. We're doing great.
And I fix like hundreds of wrist fractures a year. He didn't have like the easiest slam dunk wrist fracture, but it wasn't the hardest. So, I was like, okay, well, let's tackle this. And so then he flew home.
In a way, it's like having your friend, there to help you. Because I think what happened with me in this is you kind of take a step back. And I remember the night before surgery, I was like scared because you kind of think about everything that can go wrong.
It is a very surreal moment when you see your friend / colleague in a gown in the holding area.
With the lunch lady hat.
NPO.
Wearing those little yellow socks. The best I'd felt through the whole process was when I met him in pre-op. Like, this is what we're gonna do. From now till day 10, we're gonna keep you in this splint, and then we're gonna not let you do this till then, and it's probably gonna be 3 months before I'm gonna let you do X, Y, and Z. And I think it was kind of then I was like, thank God. Thank God I got him here, because it's just really put me at ease.
I was nervous actually operating on Chris. And then you have that moment where you're almost inside your own head and you're saying, okay, we're operating on Chris Jones, but now let's desensitize. And as a team, we have to get a job done. And so there comes a moment where you just have to rely on your skills, you have to rely on your training and what you know. And I remember distinctively Chris texting me a photo of him taking his brace off 3 days later and eating a steak dinner and saying that his wrist feels great, Doc. I can even cut my steak with my operative wrist. Chris was a great patient over that course of the month, and we had a good outcome. It's been a fun journey, honestly. It's been kind of awesome having a colleague as a patient, because now he's my greatest spokesman. I'm his
hype man.
Yeah.
I know his skill set, I know how he treats his patients. I know that if something goes wrong, which can happen in what we do, he's gonna be there to help me through it. And I think also, I just like Todd. I think he's a solid guy. He always does the right thing. He cares about people, he cares about me. And I think it was an easy sell.